Epidural anesthesia actually blocks this sensation. So the nerves don't feel pain and they're not sending signals to the brain that, something is painful. What's up, beautiful people? Welcome to another exciting episode of Labor Room with your pregnancy partner, Dr. O. You already know. And today we're discussing something very important. This topic is actually being discussed by popular demand, right? Because these days, especially for first-time moms, you hear a lot of horror stories about pregnancy, how labor is so painful, how labor is the worst thing you can ever experience, how you almost feel like you're dying, blah blah and blah blah and blah blah. So because of all these scary stories, frightening stories, horror stories, people are like, you know what, I don't think I want to go through this labor pain. Like, I actually don't want to go through this. For me, my first pregnancy, mine was different, right? Everyone was running for epidural. I'm like, no, I want to experience this pain. Like, I want to know what it feels like so I can be able to explain to people, tell people, teach people just like I'm doing right now, right? It's always easier to teach when you're teaching from experience, right? So I can tell you this is how it feels, this is how it is, right? So in my own first pregnancy, I chose to go through that pain. But of course, that's not the same for everybody. Like, not everybody's crazy like me that wants to feel pain. Like, why? Like, I would rather not feel any pain. So most women, when the option is available, they opt for having an epidural anesthesia. So for those who don't know, what's an epidural anesthesia? So this is an anesthetic. So anesthetic is like medicine, right, given to you to numb pain. So whenever you get an anesthetic in any part of your body, you would not feel any pain at all. The most you feel is pressure. So you might feel when someone is touching you, but you wouldn't feel pain, right? So that's basically what anesthetic does. So epidural anesthesia, right, pretty much numbs labor pain, right? So this is like an anesthetic that is injected into the area surrounding your spine, your spinal nerve. So nerves are the ones that conduct signals for pain. So when something pinches you, it is your nerves that send signal to the brain that this thing is really painful, right? So that's part of the functions of the nerves. Epidural anesthesia actually blocks this sensation. So the nerves don't feel pain and they're not sending signals to the brain that, something is painful, right? So you don't feel pain and everybody is happy, right? So most women opt for this, like, why do I have to go through labor pains? Like, gone are the days when people had to labor in vain. Now you can be labor and eating popcorn, taking ice cream, watching TV and, just waiting for the baby to come out because you're not feeling any pain, So, who wouldn't want that, right? So basically today we're talking about the pros and the cons of having epidural anesthesia. So first of all, let me tell you how it's done, right? When you are in the labor room, when you go into labor, right? First of all, during your prenatal visits, you'd have opted for whether you want an epidural anesthesia or not, right? During your prenatal visit, especially when you're getting to the third trimester, closer to your due date. So they will already get all those information from you ahead of time, right? Or even if you didn't opt for it during your prenatal clinic, you can still opt for it while you're in labor. But they usually like giving it only in the first stage of labor. So first stage of labor means before your cervix is fully dilated and it's time to push. That's preferably the time to give the epidural anesthesia. And they cannot give you the anesthesia when you're having contractions because you need to keep still to be able to receive it. And of course, when you're having contractions, you can't keep still. No, that's just not physically possible. You're having contraction pain and someone is poking you with a needle, like that's not gonna happen. So most times they want it in the first stage of labor and in between contractions, so when you're not having contractions, so that you can keep as still as possible in order not to cause any damages or accidents, right? So the two positions you can take when you're getting epidural anesthesia is either you're sitting up, then they give you a pillow and tell you to hug a pillow so that your back will be bent. That way they're able to have easy access to the area where they want to inject the anesthetic, which is at your back, the lower back. Or they tell you to lie down and curl yourself up in a ball. You're still bending your back so that they have easy access to that area where they need to inject the anesthetic. And what happens is they would put a long needle. So please, when they want to give you anesthesia, try not to look at the needle because it can be scary, right? You'll be like, who are you bringing that onto? It's like somebody wants to stab you and you're sitting down there. No. So it could be a little painful, like you feel a little prick when it's entering, right? But that's it. Once it's entered, right, then they put a plastic tube in and remove the needle. That plastic tube is going to be there throughout your delivery process, right? So that if they need to give you top up doses of anesthesia, they will do that through the plastic tube. The plastic tube, you won't even feel it's there. It's not painful, right? It's just a rubber kind of tube. So basically, after you receive the epidural injection, it takes about 5 to 30 minutes for it to kick in. So within 5 minutes, you don't feel pain anymore. So no matter how much contractions you get, you won't feel any pain, right? You just know that, okay, you're having contractions. In fact, sometimes some women, they don't really know they're having contractions. They have to rely on the cardiotograph to tell when they're having contractions, or when you see that your tummy is getting really hard, you know that you're having contractions, but you're not feeling any pain. So now there are a few categories of women where this epidural anesthesia may not necessarily work, right? In terms of they inject it and the people are still feeling pain even after 30 minutes, 45 minutes, 1 hour, and it's like, this epidural is not working. And they might try and increase the dose or something, but it still doesn't work. Then they opt for other forms of anesthesia. For some of them, they even give them general, like they put them to sleep, right? It happened to my friend. She had a CS. This one, she was going for spinal anesthesia, and it failed. They gave her and it just wasn't working. She was still feeling pain. She was still feeling everything. And she's like, no, don't even attempt to cut me open. Like, I can still feel everything, you know. So they had to basically give her general anesthesia, the one where they put you to sleep. And that was how she was able to do her CS. So sometimes it doesn't work for everybody, right? But more often than not, it works, right? We have a higher percentage of success rates than failure rates with epidural anesthesia. So let's jump right into it. What are the pros and the cons of taking epidural anesthesia? One obvious pro is that you don't feel any pain at all. Like, we don't have so much fun. Like, you go into labor and you don't even know you're in labor because you're not feeling nothing, right? And then before you know it, your baby's out. That's bliss, trust me. So that one is definitely a pro of using epidural anesthesia. Another good thing about it is that it is safe. It's generally safe, right? For most people, it's safe. For the most part of it, it's safe to use. You really don't have to be scared. Like I said, there have been more success rates than failure rates with using epidural anesthesia. Another good thing about epidural is that for those people that have prolonged labor, you know, those labor that first stage alone, they are like there for like 10 hours, 12 hours, right? Those kind of people, epidural really helps, because imagine going through that much pain for that long. Like, it's torture, right? So when you have epidural, you don't feel the pain, and then you can even nap in between, right? While you're waiting for the baby, you can take a nap. The benefits are just wow, right? So I don't blame people that choose to use epidural, like, can't come and kill myself kind of thing. However, everything that has advantage has its own disadvantages or cons. So now the disadvantages of using epidural. So one of it is that you have to have close blood pressure monitoring, right? Because when you're using an epidural, there's that risk of your blood pressure dropping. So there's that risk of hypotension, also known as low blood pressure, and this can be very dangerous. So your anesthetist has to monitor your blood pressure closely and make sure that your blood pressure does not drop below normal levels. That's very important. And another thing is the fact that because you can't feel pain, you also don't have control of your bladder muscles and all that. So you would need a catheter, right? So catheter is that tube that they insert into your urethra. That's the tube where urine passes through. Okay, so it collects urine in a bag for you. So that tube is connected to a bag that collects your urine, right? So you would need to wear a catheter. And for some people, this is really dreadful. Like, wearing a catheter. You can feel uncomfortable when they're inserting it, but after it stays, it's okay. But then you still feel the urge to pee, but it's weird because you can't really pee at. Okay, I've had a catheter in before, so I know how it feels. That's how come I'm able to explain it. Like I said, experience is always the best teacher. So yeah, it's not the best feeling. So you need to have a catheter if you're going to have epidural anesthesia. So that's one of the downsides, the not so fun sides of having epidural. Another downside of epidural, sometimes it actually prolongs labor, just because sometimes you're not able to feel the contractions. And you know that you push with contractions for the baby to move down the birth canal. So of course, if you can't feel the contractions, then you won't know when to push. So sometimes you need people to tell you, okay, you need to push now. It's time to push. They will need the help of cardiotograph to see when your contractions are at its peak, or sometimes they will need to just touch your tummy to feel the consistency of your uterus and say it's hard. Okay, it looks like you have a strong contraction. Now push. So it makes the whole labor process longer. Not to also mention that women that do epidural, most times they're not able to push, like I explained. So they normally need assisted methods of delivery, like the forceps or the vacuum delivery, right? And the last downside is that you lose sensation in your legs for a while, a couple of hours after the whole labor procedure is done. So you may not be able to stand up on your feet and walk just yet. So that can be annoying because you just gave birth, you want to have your baby. Yes, you want to relax, but after a while you want to get up and walk around, but you really can't do that until the anesthesia wears off, which might take hours. So that can be annoying, right? So yeah, those are about the pros and cons of epidural anesthesia. So weigh your options, right? Look at the pros, look at the cons and see if epidural anesthesia works for you or if it doesn't, right? So let me know, veteran moms, have you used epidural anesthesia before? How was it? What was your experience like? Did you like it? Did you not like it? Did you use it again, right? And for those new moms, are you going to be using epidural anesthesia or no? So next week, we're going to be discussing the risks and side effects of using epidural anesthesia. This will further help you to make an informed decision on whether or not you want to go for epidural. If you enjoyed watching this video so far, don't forget to like, subscribe, and share with someone who you think might need to see this. Remember, like I always say, every pregnancy journey might be different, but your pregnancy partner, Dr. O, remains the same. See you next week.